So I think we're moving into a world where we're looking at care as quality-based instead of quantity-based. And we all know that a certain percentage of patients who are very sick, often at the end of their life, use up a lot of healthcare dollars. And if you ask those patients what they want, they don't usually say, yeah, I want to spend all my time in the hospital. They say, I want to be home. I don't feel like I'm getting good health care. I don't feel like things are communicated well to me. So how do we, specifically with that group of people, how do we manage them better? And that, I think, is what all ACOs, or so everybody who's struggling with shared savings models and looking at quality-based care is looking at. And this is what we do in palliative care. We manage patients with multiple medical issues. You know, a young person has a heart attack, and you put a stent, you give them some medicine, they do well. An older person has a heart attack, they may have heart failure, they might have had a stroke. It may not be so easy, they might have bleeding. So how do you manage all of those multiple issues all at once? That's what we do in palliative care, and that's what ACOs are looking for. Often when we say what's important to you, these patients will say, I don't want to be in the hospital. So if we can put structures in the home, so nurses who come to the home, nurse practitioners, sometimes even housekeepers, things like that, into the home to help give these patients what they need in the home, it keeps them out of the hospital, which is really a win-win, because that's what patients want, and it's what hospitals want as we're looking at penalties for readmissions. So I really think that is why the people who are thinking about how we pay for healthcare are really focusing on palliative care as at least a part of how we manage our sickest patients. And I think in the past, when we've really looked at healthcare as you get this procedure, you get this number of dollars, palliative care has not been seen as a money-making operation. But now I think we're in a time where the better care for patients that gives them the type of healthcare they want actually becomes financially feasible. And so more and more health systems are making this a priority.